Our next item of business is consideration of Business Motion 21331 in the name of Graham Day on behalf of the Parliamentary Bureau on the referral of the Local Government Finance Order 2020. Can I call on Graham Day to move this motion? Okay, okay. Could I ask Liz Smith, as a member of the Parliamentary Bureau, to move this motion?
Moved.
Thank you very much, Ms Smith. No member has asked to speak on the motion. The question, therefore, is that motion 21331 be agreed. Are we all agreed? We are agreed. The next item of business is consideration of Business Motion 21332 on behalf of the Bureau setting out changes to this week's business. And again, can I ask Liz Smith to move this motion?
Moved.
Thank you very much. This motion condenses parliamentary business to one day, so we'll be meeting today, but we will not be meeting tomorrow or the next day. Are we all agreed? Sorry, the question is the motion 21332 be agreed. Are we all agreed? We are agreed. Now, the next item of business is a statement by the First Minister, Nicola Sturgeon, on the coronavirus COVID-19. The First Minister will take questions at the end of her statement. In fact, I believe she'll be followed by a statement from the Cabinet Secretary for Health, Jean Freeman, and then the First Minister and the Cabinet will take questions on COVID-19. And members who wish to ask a question to press their request to speak buttons as soon as possible. And I call on the First Minister.
Thanks, Presiding Officer, and thank you for the opportunity to give an update on our response to the COVID-19 pandemic. First of all, I can confirm that as of 9 o'clock this morning, there have been 584 confirmed cases. That's an increase of 85 from yesterday. As always, let me be clear that these numbers will be an underestimate. It is also with sadness that I can report that there have been a further 2 deaths of patients who had tested positive for COVID-19, taking the total number of deaths in Scotland to 16. I want to extend my condolences to all of those who've lost loved ones and again thank our NHS staff who continue to care for people suffering from the virus. Cabinet Secretary for Health will provide more detailed briefing in a few minutes. But I want to begin with an update on some key points. As everyone knows, last night we announced significant new measures to slow the spread of COVID-19. Let me quickly reiterate what these are, because I want people across Scotland to be very clear what is now expected of all of us. Effectively, Scotland is now in lockdown. People had already been told that they must stay at home. We've now set more stringent limits to that. So the only permissible reasons for leaving your home are as follows: to shop for basic necessities, but only once a day at the most; to take exercise, again, no more than once a day, and this should be done alone or with your household, not in groups; for medical reasons for yourself, or if providing care or to support a vulnerable person; and to travel to essential work if that work absolutely cannot be done from home. All social events are now banned, and public gatherings of 2 or more people, excluding households or for essential work-related purposes, are also prohibited. Communal places such as libraries and playgrounds must close. Places of worship should also close, other than for funerals, which I'm deeply sorry to say must now be restricted to immediate family. I know that there have been some questions about families who live apart. Children under 18 can continue to move between households, but they should, in doing so, take hygiene and social distancing precautions. And I also want to confirm that those who have caring responsibilities or who work in care should continue to carry out those responsibilities, but again, should follow social distancing measures as much as possible and hand hygiene at all times. But the overall message is very clear. People must stay at home. I know how hard this is for everybody, but people should not be meeting friends. They should not be meeting family members who live outside of their home. And as I have said previously, for all of us right now, life should not be feeling normal. If it is, then you're almost certainly not sticking to the rules that we are asking people to abide by. I'm confident that the vast majority of people will comply with these rules, and I want to thank everyone in advance for doing that. However, later this week, the emergency legislation that Parliament will discuss shortly will give us powers of enforcement, and I want to be very clear, we will use these powers if necessary. I want to say a bit more about the implications of the current situation for businesses. Since I addressed Parliament last week, the UK Government has taken helpful and very significant steps to support wages. I know that doesn't come into force until the beginning of April, but I hope that by working with lenders, businesses will now be able to do the right thing and not lay staff off unnecessarily. I can also confirm that the application process for the Small Business Grant Scheme, which was announced by the Finance Secretary here last week, is now live, and details of how businesses can access and apply for that are available on mygov.scot. I can also assure self-employed and freelance people that the Scottish Government continues to argue for the UK Government to put in place support for them, and the Cabinet Secretaries for Finance and the Economy wrote to the Treasury on that matter again yesterday, and I'm very hopeful from the signals given by the UK Government that we will see positive announcements on this soon. If I can now turn to the issue of work and the closing of business premises. And let me start, Presiding Officer, by acknowledging the very acute challenges that businesses are facing right now, and also thank the vast majority for the very responsible approach that they're taking to protect the health and well-being of their workforces. However, I know that there remains some concern that businesses and employers don't know what advice to follow, so I want to be clear today about what the Scottish Government is expecting. And firstly, I want to stress that it is employers who should be making these decisions. It should not be up to employees to anguish over whether or not they should be going into work. And I would also say that, as I'm sure people will appreciate, it's not going to be possible for us to make a decision or offer bespoke guidance for every single different business in Scotland. This is difficult for everyone. But the guidance that I'm about to set out, when you strip it back, I hope will help businesses navigate these difficult decisions. It is clear that there are categories of business that have already been told to close. On Friday, that included pubs, restaurants, cafes, cinemas and gyms. Yesterday, we published a list of essential and non-essential retail. Non-essential retail premises are now required to close, and of course shopping for basic necessities kept to a minimum. That list is being updated to include other forms of establishments and those critical for civil contingencies. In particular, it's important that key strategic sites vital to economic resilience and which can't be easily shut down, for example the steelworks at DL, can continue to work so long as they can maintain the minimum number of required staff and the social distancing requirements. However, I am aware that there will be many businesses out there that don't fit neatly into any of those categories, manufacturers and food producers, for example. For these businesses, the advice, which is very much based on a precautionary principle, given that our priority here is the protection of health, is broadly as follows. Firstly, if your staff can work from home, then that is what you should allow them to do. Secondly, if your staff cannot work from home, you should be asking yourself if your business is contributing something right now that is essential to the fight against coronavirus, for example, making medical supplies or manufacturing essential items, or is it contributing something essential to the well-being of the nation, for example, food supplies? If it is, we want you to keep going if possible. But the questions you must ask yourself is, can you operate your business in line with safe social distancing practice and, of course, your normal health and safety requirements? If you cannot answer yes to those questions, then in our view, you should not continue to be open. We've been asked specifically about construction sites in Scotland, and our advice right now on the basis of that precautionary principle is that we would expect them to be closed unless the building that is being worked on is essential, such as a hospital. We know that for some people, for example, self-employed gardeners and window cleaners, where there is no contact with other people, if they can go about their business safely, then this can be good for the community, and we would encourage them to do so. For the many people who are looking to volunteer and help out in their communities, there is advice available on readyscotland.org on how to do so safely. It will, of course, continue to be vital that local authorities put in place arrangements for the children of key workers and vulnerable children. The teachers and other education staff who are providing this service are themselves key workers, and I want to thank those who followed the advice so far, and in particular all those parents who are now looking after their children at home, and the teachers and early years workers who are caring for vulnerable children and those of key workers. We will have indicative numbers on attendance later today, but our initial reports are that the vast majority of parents are not seeking to send their children to school. And finally, Presiding Officer, Parliament, rightly, as you've just indicated, is also changing how we operate. Although, and I want to make this point very strongly, all MSPs must continue to perform a very important scrutiny role in a time like this, I understand it has been agreed that until the Easter recess at least, Parliament will now only meet for 1 day per week rather than 3. Presiding Officer, I want to conclude with a basic point. The measures that have been announced in recent days, from the school closures last week to last night's lockdown are really, really difficult for every single individual and business and organisation across our country. And they are truly unprecedented. But they are unprecedented for a reason, because the challenge we face is also unprecedented. As I've said before, this is by far the biggest challenge our country has faced in our lifetimes. And so the measures we take to deal with that and to seek to mitigate its impact must reflect its magnitude. The changes we're asking people to make to their lives, difficult though they are absolutely essential. They are essential to help us slow down as much as we can the spread of this virus. They are essential to reduce its peak impact. They're essential to seek to avoid our NHS becoming overwhelmed so that it can instead continue to provide treatment for all those who need it. And they are essential to save lives. The daily reality we face right now is quite a stark one. If we all comply with these measures, then many fewer of us will die of this virus than would otherwise be the case. That means many more of us will come out the other side of all of this and perhaps more quickly than otherwise be able to resume the lifestyles that we have for so long cherished and taken for granted. So for now, I hope we all show solidarity for each other, even as we stay apart, by staying in touch with those we care about and by helping each other as best we can. But let's be clear, crystal clear, collectively as a Parliament, that staying at home has become the only way of slowing the spread of this virus, the only way of giving our NHS the chance to cope, and the only way of saving lives. And that must right now be the priority of each and every one of us.
Thank you very much, First Minister. I call the Cabinet Secretary for Health, Jean Freeman.
Thank you, Presiding Officer. Presiding Officer, this virus doesn't spread on its own. It's spread by people. So what needs to happen is absolutely clear. Please stay at home to save lives. To save lives, to protect our health and social care services, to avoid unnecessary deaths. The response of our health and social care staff has been extraordinary. Every single one, from consultant to cleaner, from carer to nurse, to driver, to maintenance worker, to paramedic, is vital. Every single one of them matters. We owe it to each and every one of them to stick to the rules and stay at home. Even with the unprecedented measures now in place, we will not escape the impact of COVID-19. Having placed Scotland's NHS on an emergency footing, we have now received the mobilisation plans from all of our health boards. They set out in detail how they will maximise intensive care capacity while seeking to maintain essential services such as emergency, cancer and maternity care. We are well advanced in our work to double our ICU capacity to 360 beds. Facilities have been repurposed, staff are being trained and beds are being freed up. Our response to double ICU capacity is the international standard in response to a pandemic. But given the scale of the challenge, we are now planning to quadruple our ICU capacity to over 700 as quickly as we possibly can. A pipeline of ventilators is slated to come to Scotland over the coming weeks to enable this increase, and we are working with suppliers to do all that we can so that they can be brought here as quickly as is humanly possible. We're also mobilising our community services with a new community pathway for COVID-19. From yesterday, people with symptoms should not call their GP practice. People with symptoms should first seek advice from NHS Inform. They should be staying at home for 7 days. Only if they don't get the advice they need or their symptoms deteriorate should they call 111. Callers to 111 helpline will be assessed and called back by new local community hubs if that is clinically required. In each hub, senior clinicians are ready to take the calls. In some cases, patients will need to be seen face-to-face. COVID assessment centres are being rapidly deployed across the country with an initial 50 planned this week. This new dedicated pathway frees up our GP service to continue delivering important non-COVID-19 healthcare to patients. But it isn't just our NHS that is integral to responding to this virus, so too is social care. With COSLA, integration authorities and providers, we're working to prioritise social care support to the most vulnerable in these circumstances. Frontline social care workers are key workers who will have access to childcare if necessary to carry out their critical roles. A triage centre through NHS National Services for Scotland for urgent supplies of PPE for registered social care providers went live last week and has been taking hundreds of calls and delivering thousands of face masks, disposable aprons and disposable gloves to providers across the country. Targeted and clinical advice for nursing and residential care residents and COVID-19 has also been produced and is now also available from HPS. Yesterday, with Councillor Curry, who is the COSLA lead in health and social care, I wrote to all local authorities setting out my agreement that the costs of additional social care would be met. That is important, and it is an important assurance that people who require vital social care support should not have that removed to cope with the COVID-19 challenge. We need to ensure our health and care workforce is safe and protected, so we're working to procure and distribute necessary supplies of the types and levels of PPE required to safeguard frontline health and social care workers, and we now have a clear distribution work streams and clear advice and daily updates to our boards and to those other parts of the service that we are providing. It is essential, however, that frontline health and care staff can remain at work. To help save lives, we must continue to prioritise testing in hospitals. All the capacity that remains must be used to ensure that critical staff can return to work as soon as possible. Today, I'm publishing guidance for the NHS to support the use of the testing capacity in our laboratories that is not needed in terms of providing essential care, so that it can enable health and social care staff to be back at work when it is safe for them to do so. NHS boards will prioritise testing based on where the pressure is being most felt in their workforce and in social care. As well as our own work to rapidly scale up testing in Scotland, we are working closely across the United Kingdom to increase testing capacity significantly. And I can advise the Chamber that an announcement on that is due shortly, including Scotland's role in that effort. Presiding Officer, there has been a tremendous response to the call made by the Chief Nursing Officer last week for nurses and other health professionals to return to help in the present emergency. By yesterday, there were nearly 3,300 individual queries. People are contacting our National Recruitment Hub on 0141 278 2719 and making direct contact with their health board. In addition, all final year nursing and midwifery students will be put onto a placement for the final 6 months of their degree programme, which will enable them to undertake paid work in the NHS during this period and still complete their degrees on time. Final year allied health professions and biomedical science students will complete their clinical hours and then will be able to go onto the emergency register and be deployed in the workforce. Second year nursing and midwifery students will also have their education changed so that they can undertake paid work in health and social care settings throughout Scotland whilst continuing with their courses. Discussions are ongoing on the use of second and third year allied health professional students, but I hope that we can agree similar arrangements. And all first year students will be able to undertake paid work if they wish. And I very much welcome those medical students willing to volunteer to support our services at this time and the steps taken by the regulator to support their entry onto the register. We will ensure that all of these volunteers are deployed and in the safest and most appropriate way. I'm sure that every single one of us here is truly grateful to all of them for stepping forward to serve us at this time. We cannot have barriers to staff working in the NHS. Last week, I said that I would act, if I could, to remove parking charges from those PFI car parks in our hospital settings. So from Monday the 30th of March, car parking charges will be removed from Ninewells Hospital in Dundee, Glasgow Royal Infirmary and the Edinburgh Royal Infirmary for the next 3 months. Presiding Officer, given the figures that we know we are dealing with, it is even more critical that we protect and support the people in our communities who are at the highest risk. That is why we have asked the 200,000 or so people who are at the highest clinical risk from COVID-19 to self-isolate for the next 12 weeks. This includes being as far as possible from other members of their household. This group includes people who have received solid organ transplants, have specific cancers, have rare diseases, are on immunosuppression therapies, or have severe respiratory conditions. That is incredibly hard for them. We are therefore writing to these individuals, setting out what they and their families need to do to stay safe and how they will be helped. Many people will have family and friends who can support them over the next 12 weeks, but others will not. For those people, we are putting in place a package of support. To coordinate this work, the Deputy First Minister has ordered the establishment of a humanitarian assistance centres across the country as soon as possible. Working through GPs and local resilience partnerships, we will provide help with managing medical conditions, arrangements for delivering medicines and services, including carers. Crucially, it will also include grocery deliveries through a new national contract which is currently being negotiated. Presiding Officer, the key to saving lives, to avoiding unnecessary deaths, is for all of us to comply with the measures set out by our First Minister and across the United Kingdom. I know it is hard. I know that life seems unsettling and strange. But it is vital that we all accept now, today and tomorrow that that is how this must be. That is how all of us honour the hard work of our NHS and social care staff. That is how we go beyond warm words and really, truly thank them for their courage and their care. We stay at home and we follow the rules. Thank you.
Thank you. The First Minister, the Health Secretary and the other members of the Cabinet who are all present will be willing to take questions now. Jackson Carlo.
Presiding Officer, can I, on behalf of my party, add our condolences to the families of all those who've suffered bereavement since last week. As both the Prime Minister and the First Minister have made clear, we are living through a national emergency. The clear duty borne by us all is to accept and apply the advice we are given. Where clarity is required, to seek that clarity rationally. Where detail yet remains to be made public, to accept that that detail will be forthcoming. Our leaders here in Scotland, just as at Westminster, are all applying themselves with every endeavour to steer the country through this crisis. They need our support, our forbearance and our gratitude. But that is as nothing to the debt of gratitude we owe to every last one of those working in our emergency services, but above all in our NHS, where they are working, where indeed others are now volunteering to return to work, all to keep us safe. Now, last Friday, I endured an exploratory procedure at Glasgow's Victoria Hospital. Thankfully, all was well, but more appositely and in the most humbling of ways, NHS workers approached me to say, "We will not let the country down." Presiding Officer, I never doubted it, and I'm so very proud of every one of them. But that pride in all those working in our National Health Service, a pride I hope felt by every last man, woman and child in Scotland, deserves to be backed up not just by our words, but by our actions. So let me repeat, stay at home, abide by the guidance given. It's common sense. And while it's true that the problem with common sense is that it's not often so very common, so people should listen and listen good. Stay safe yourself, protect our NHS and help save lives. Presiding Officer, can I ask the First Minister to do all she can to work in conjunction with the Prime Minister to ensure we achieve the maximum clarity and, wherever possible, a consistency of messaging? Now, more than anything else, people are seeking clarity, and I know both governments are responding to evolving events, but any confusion in messaging is naturally unhelpful and is a source of many inquiries which could be rendered unnecessary. Today, that centres on who should be going to work, and particularly those in the construction sector, with both the Prime Minister and the Secretary of State for Housing, Communities and Local Government giving slightly different, it seems, emphasis on whether or not those in the construction sector should be going to work. I understand from my own local authority, East Renfrewshire, that the uptake at schools by critical workers has been low and manageable. However, I know too that the variable sector inclusion on the key worker list between Scotland and the rest of the UK remains troubling to key sectors in Scotland, and in particular food processing, distribution and agriculture, as does the further variable application by individual local authorities. Now, our priority must be have as few children at school and only as a last resort. However, can the First Minister update the Chamber on the current uptake and the discretionary position across Scotland? And finally, there are a myriad of issues, for example, those with vehicles needing immediate MOTs, the burden of compliance with FOIs on local authorities, with reduced and refocused staff complements. Can I ask the First Minister where general inquiries of a practical consequence in relation to other issues should be directed? Presiding Officer, as Churchill once observed, it is not enough to do our best, we must do what is required. In closing, can I offer again the support of my party to the First Minister and her colleagues as they do what is required?
First Minister.
Can I thank Jackson Carlaw for his comments, his exhortation to the population to follow the stay-at-home advice. I think it is important that all of us consistently, coherently and unequivocally advise the public to do exactly that. A number of points of detail have been raised there. I'll cover them as quickly and as generally as possible. If there are points of detail I don't cover here, we will come back with a detailed answer later on. Can I say, in terms of the NHS, as the Chamber knows, I spent 5 years as Health Secretary, and I feel this as First Minister. There's not a day goes by when I'm not in awe of the contribution of those in the front line, in particular of our NHS, but everybody who works in our health and social care services. But I am acutely aware every day just now that we will never owe them more than we owe them in the weeks to come. I want to make sure that as government we are doing everything we reasonably and possibly can to support them. That's why the car parking charge announcement that the Health Secretary has made is so important as part of that. There have been issues, I understand, but we are working hard to resolve around the distribution of protective equipment. And these are just examples of how we will absolutely do everything we can to support our frontline workers. And most of us will be able to cite examples of this. My own sister works in the front line of the health service. She was in a hospital ward yesterday morning. She was in a hospital ward this morning. She'll be there again tomorrow morning. So I know firsthand the pressures that they are under right now, and I know my responsibility and that of the government to support them. But the thing we can all do to support them most is to follow the advice, because that is what will help to, if not eradicate that pressure in the weeks to come, then keep it at manageable levels so that the people who need treatment can get it. Secondly, on coordination across the UK, I think I know we're working very hard to do that, not just the Scottish Government, the UK Government, the Welsh and Northern Irish governments too. And I think we are being very successful in coordinating both our response and our messaging. The response overall is the same in all parts of the UK in terms of the advice we're giving to the public. Last night on the COBRA call, before the lockdown measures were announced, we agreed to coordinate the timing and the content of our messaging, and I think that is important. I've always said, and I think people can understand that, there will be operational differences because the structure of our NHS is not the same. So the way in which we're contacting the most vulnerable people will be slightly different. And also, we have a responsibility to make sure that the overall approach is being translated into the advice we think is appropriate. I can't speak for other administrations on some of those operational issues. We will try to make sure it's as consistent as possible. But on construction, for example, my judgment, based on the advice I have, is that right now the safest, most precautionary principle is for construction sites not to continue. We have undertaken to look at whether there is a guidance that could be put in place for the safe operation of construction sites, taking all of the social distancing advice into account. And if we think that is the case, then of course we will share that and amend that position if we think it is appropriate. So we will continue to be as consistent as possible, taking account of those operational differences. Similarly on schools, we have to remember why schools are closed right now. It's for a health reason, because the experts have told us that it helps delay the spread of the virus not to have large numbers of children congregating together. So we defeat the purpose of that if we then have large numbers of children congregating together in other ways. So we've had to be very rigorous about key workers and vulnerable children. The priority has to be those in the front line of the NHS, but we have said we will seek to accommodate others as and when we can, based on a rigorous prioritisation, and there is a brokerage function that the Scottish Government is applying there. I said in my statement we don't yet have figures for uptake, but when we do, we will share those. But our evidence so far is that the vast majority of parents have not been sending their children to school, and therefore that may give us some more, but it will be limited capacity to look at other areas. There were some points made about, I think, FOIs, which have been covered in our emergency legislation, and the point about general inquiries. I will endeavour and undertake to give some advice to MSPs, particularly when we're not sitting as often as normal, about the best route for inquiries and for questions, and indeed for the many offers of help that I know MSPs are getting from across their constituencies as well.
Thank you. Richard Leonard.
Thank you, Presiding Officer. And can I express the condolences of these benches to those families who have lost loved ones through COVID-19 in the last few days. I also want to say that at a time of a national emergency, we think this national Parliament should not go into Easter recess, but that we should continue to scrutinise what is happening in the midst of this emergency. We think that is our job, and we genuinely think that is what the people who sent us here would want us to do. So I would ask all parties to consider whether we should go into recess or not. We do not think that we should. I want to pay tribute again to all of those NHS and social care workers, not just for what they have done, but for what they are about to do. Nobody knows what the future holds. It is unwritten, but one thing is certain. We will all be reliant for our health, for our safety, some even for our lives, on their skills and their judgment. We will all be forever in their debt, which is why now more than ever, we must give them our total and unflinching support and recognise and so exercise our full duty of care to them as they exercise their duty of care to us. We must listen to them, to their calls, and so give them the best personal protective equipment when they need it, which is now. We must give them the reassurance of access to testing in case of any symptoms. And because many of them are out working in the community, home care workers, community nurses, ambulance crews, can I ask the First Minister, can I implore the First Minister to give them an undertaking that you will reconsider the case for community testing, the case made by the World Health Organization, the case for community testing and so tracing and tracking to help slow down the spread of this virus, to keep people safe. First Minister, will you hear this call?
First Minister.
Can I thank Richard Leonard for his comments and for all these questions? Can I take them in turn? Firstly, it's not up to me when Parliament sits, it's up to the Business Bureau when Parliament sits, and I'm not expecting to be having an Easter recess, so it, in a sense, makes no difference to me whether Parliament is sitting or not. I'll be working, as I'm sure all of us will be. But our practices must reflect the guidance that has been issued to the general public, and I think today they do. Cutting down the sittings this week, I think, do that, and I'm sure that will be kept under review by the Bureau. But what I would say, and I've said this consistently, and at a time like this, I absolutely, you come to understand even more than you do normally how important the function of scrutiny is. You know, we are living through unprecedented times when we're asking people to do unprecedented things. In a democracy, there must be some scrutiny of that. There must be rigorous scrutiny of that. I said last week, and I will say again, we're trying to think of everything in government right now. We're trying to make sure we've got all bases covered, but we will miss things, or there will be things that we're perhaps not doing as well as we could. So the questions that are coming are really important. So all I would say is the way that scrutiny happens has to change because of the guidance that is out there, but the fact of the scrutiny doesn't have to change. And if anything, it is more important than ever. And I mean that absolutely sincerely. In terms of the points about the NHS, the duty of care that we owe to NHS staff is one that I feel acutely and personally every single day, not just during these periods, but particularly during this period. We are listening, so there were concerns raised about the ambulance service and PPE. The Health Secretary met with the ambulance service last week to resolve those issues. We will do that systematically. If there are concerns being raised in this difficult, challenging, uncertain period, we will address those as far as we possibly can. The issue of testing, I want to come back to this because the way we slow down the spread of this virus is by staying at home and following the advice. We are ramping up testing capacity, but we have set 3 key objectives for our testing capacity, and they are the right ones given the stage of the spread of this infection that we're at. And that's not me saying that from my own knowledge as a politician. That is what I have been advised by our Chief Medical Officer and by other experts. The key objectives of our testing are to make sure that we are dealing with those who are most seriously unwell. That is why patients in hospital will be tested. Key workers, and the announcement that the Health Secretary indicated will be coming soon, will have a significant impact on the key worker testing, and then surveillance to make sure that over the weeks to come, because this will be critical in our judgments about whether more measures are necessary, or indeed whether and when we can start to lift some of these measures, is what this infection is doing, how fast it's spreading, where it is in the country, and that is why surveillance testing is so important. All of that involves considerably increasing the capacity of our testing facilities, and that is the work that is underway in a variety of different strands right now, which Parliament will be kept updated on.
Patrick Harvey.
Thank you, Presiding Officer. Can I first of all echo the comments of others? All of our thoughts are with those who have been directly affected by the virus, having lost a loved one or indeed being unwell at the moment, and we wish them a speedy recovery, and with the very many dedicated professionals who are helping people through this crisis in every way possible in our public services and elsewhere. None of us in Parliament expected to be here to deal with a situation like this, or to pass the kind of emergency powers that are being contemplated, and I'm sure no one in government wants to be in a position of issuing the kind of instructions to the public that were made last night. But this response is very clearly necessary, and so the government will have the support of the Scottish Green Party in ensuring that this advice is heard and is heeded, that we all save lives and stay at home. In order to do that, of course, we need to have a home. And I am sure that I'm not alone. I know that other colleagues have been hearing on a daily basis from people in the private rented sector who have been given notice to quit by landlords in these circumstances for a range of grounds not always connected with rent arrears, or being given demands for ongoing rent payments, sometimes from landlords who are enjoying a mortgage holiday. I know that there are good landlords out there who are being as responsible and as flexible as they can in supporting their tenants, but sadly that is not always the case. So surely we need to ensure that there is a more robust response protecting private rented tenants. Can I ask the First Minister how she responds to the proposals from NUS, which come in 5 parts? Clear public health advice for landlords and tenants. Every landlord offering a no-penalty release from tenancy contracts. Governments banning evictions for all tenants throughout the duration of this crisis. Ensuring that tenants who are financially impacted by the crisis have their rent subsidised, reduced or waived for the next 3 months with the option to renew. And finally, a universal restriction on rent increases for the next 12 months. Surely we need to take the opportunity of the emergency legislation which is being brought forward by the Scottish Government later this week to ensure that we give the maximum possible protection to ensure that no one loses their home as a result of this crisis in what are deeply dangerous circumstances.
First Minister.
Can I thank Patrick Harvey for those points and questions. On the issue of emergency powers, I'm very clear that these emergency powers are necessary, but they should only be used if and when we deem them necessary to use, and they should only exist for as long as they are needed. And I would go back to the point I made earlier on. At a time when we are taking emergency powers, when we are asking the public to do things that restricts the liberty of all of us, scrutiny is absolutely essential, and I think we should all reflect on that in terms of how we operate in the weeks to come. On the private rented sector, I'm very happy to look closely at the NUS plan. I'll ask Mike Russell, who is overseeing the emergency legislation, to look quickly at whether there is material from that or suggestions in that we can include in the legislation, or even whether there are aspects of that we could do without emergency legislation. Aileen Campbell will obviously be very involved in that as well. I was clear last week at First Minister's questions, and I'll be clear again today, nobody should be evicted from their home as a result of this crisis, and I will make that clear at every opportunity. We've already indicated a legislative change we will make to expand the 3-month period for which people can't be evicted in terms of rent arrears to 6 months, and we will continue to look at how we give people additional security over and above that. So I hope it's helpful that we will look urgently at the suggestions from the NUS and seek to incorporate them as far as possible, and look for other opportunities to send that very clear message to not just private sector landlords, but landlords across all tenures.
Thank you. Willie Rainey.
Presiding Officer, my sympathies too are with those who have lost families, friends and neighbours. I don't know anybody who's been afflicted by this disease yet. I think when we do, I think it'll become much more real, and I think people might take it a little bit more seriously in some quarters. And that's why it's really important that people do heed the advice of the First Minister to stay at home, to protect the NHS and to save lives, because when it comes, it's going to hit hard. I have to commend the government and all the civil service. We're effectively creating a new government system within the space of 2 or 3 weeks. So as the First Minister said before, we are going to make mistakes, and today is about helping the government to try and mend some of those mistakes. Firstly, on childminders, there seems to be an issue about who childminders can accept, whether it's just key workers and vulnerable children, or is it a broader group? And I've been speaking to some of your colleagues about that, but it would be helpful to have some clarity on whether childminders can accept beyond key workers and vulnerable children. As I was driving into work today down the M90 motorway, there was a whole sweep of vans going up the M90 to building sites, packed full sometimes with workers, obviously not complying with the social distancing guidance. And I would hope we could particularly send a special message to workers that they do need to comply with this as well if we're going to halt the spread of this condition. They may be worried because they are self-employed that they need to go to work to earn an income. And that's why the UK government does need to come forward with a self-employment package to take the pressure off that sector so that they can have something to live on. I appreciate the clarity on factories and workplaces, the difference between essential and non-essential. I've already had some businesses while I'm in the chamber contacting me about this. Still a little bit unclear about what actually is essential to make society work. So perhaps the First Minister could say a little bit more about what we mean on that front. And then PPE supply, I'm continuing to get lots of concerns, not just from NHS workers, but social care and nursing homes about the lack of PPE equipment. And I'd quite like to understand where the actual problem is. Is it on the distribution mechanism, or is it on sourcing them in the first place? There's a lot of questions there, but I hope the First Minister can address a few of them. First Minister.
Rainey, for that range of questions. I'll try and give an overview just now, but we'll come back on any points of detail that are necessary. I think he's right about people taking this seriously. And my impression, and it is impressionistic, is that people are taking this seriously in the main. But I guess in a situation like this, there is a sense of it feeling really surreal. And for the majority of us, we haven't come into contact with somebody who has the virus. So that will change, but I think my message would be, if we want to continue to reduce and minimise the number of people we know who have this virus, then do the right things now, and that is the best way of doing that. We also know that while the sort of estimates globally, and certainly based on the data here, is that the mortality rate from this is perhaps around 1%. that increases steeply as people's age increases. So it's much, much higher than that if you're in the over 70 or over 80 group, which for all of us, even if, and I think this is a mistake for young people, not that I'm calling myself a young person, but mistake for young people to think that they are not affected, that they can't get it, or that they will only get mild symptoms. There's no guarantee of that. But even if that was true, if you don't follow this advice, you're taking the risk of infecting an older, loved relative, and they are potentially at significant risk. So we've all got to think about our responsibilities here. In terms of the comments about, we have and are kind of reconfiguring an entire government right now, and everything that sits behind the government, I want to put on record my huge thanks to the civil service. I've already said my most important thanks to the NHS, and will continue to do that. But the civil service have been working at pace and are doing a very good job with that. And the burdens and the challenges that they will face in the weeks to come are considerable too. And the Chief Medical Officer, the Deputy Chief Medical Officer, the ubiquitous Jason Leach, our National Clinical Director, all of these people are doing an incredibly good job, and I want to thank them for it. On the issue of childminders, we've not been overly prescriptive in terms of childminders. I will take away from this whether there is just a bit of guidance that we need to give to childminders to give them the parameters in which they should be operating. On construction, what you've set out here today in terms of what you witnessed on your way here this morning is why I think it's right to take a precautionary approach right now. And so my advice is that construction sites, apart from on essential sites like hospitals, should not be operating. Now, if we can put in place guidance and rules that would satisfy us that safe working on a construction site is possible, then we may change that in the future. And that is a general principle. We don't want to stop things happening if it's not unsafe for them to happen. But at the moment, it's really important that we take that precautionary approach, because this is about protecting health. On PPE, the supplies are getting through. I still want to say that if people feel they're not getting the supplies they need, they should let us know that. There is a global pressure on these supplies right now. We're looking, Ivan McKee's leading work for us, looking at whether we can repurpose some manufacturing to improve and increase the supplies of these things. But there are supplies in the country. We are working hard to get them where they are needed to be. But MSP should continue to tell us if they are feeling or hearing problems with that. And lastly, on the self-employment point, I have been inundated, as I'm sure we all have, with really worried emails from people who are self-employed or freelance workers. I believe that the UK government is taking this seriously. I believe they are working on something, and I hope that comes soon. But I want to reiterate how important I think it is that we see something similar to what's been done in terms of wage subsidy for those who are self-employed, because without that, I think these people will be in significant difficulty. So I may have missed one or two points of detail. If I have, I'll review the record and come back to Willie Rainey at a later point.
Thank you very much. I would just inform the Chamber that more than 30 members wish to ask questions or raise issues this afternoon. We'll try and get through as many as possible. I would also urge members, as we did last week, when they ask their question, if they could indicate which Cabinet Secretary they would like to hear from, that would probably be very helpful. George Adam, to be followed by Liam Kerr. George Adam.
Presiding Officer. Last weekend I was approached by many self-employed people in Paisley, particularly those that work in the leisure and entertainment industry, and how this will affect them financially. Can the First Minister provide an update? I know we're in talks with the UK Government on this issue, on the engagement with the UK Government, the Scottish Government has had, and on any financial protection for those self-employed and freelance workers in leisure and entertainment.
First Minister.
I'll maybe hand over to Kate Forbes in a second. We have been pressing the UK Government. As I said earlier, I am very optimistic we will see a solution to this, and I hope it comes soon. But Kate Forbes can update on the correspondence and other conversations.
Kate Forbes.
Thanks, Presiding Officer. George Adam is quite right. There are about 330,000 self-employed workers in Scotland, and they're absolutely critical to the economy. Both myself and Fiona Hislop have had a number of calls with our respective counterparts at the UK Government, and I believe that the UK Government understands the issue and is looking at delivery mechanisms. But our point, most recently made in a letter on Sunday, which we both signed, was that whilst things like the minimum income floor being removed, it does not go far enough in terms of support for the self-employed. And action that's been taken in other countries suggests that there are credible mechanisms to support the self-employed. And for example, Norway, Denmark, wage support schemes have been extended, and we believe that should be the case here in the UK as well.
Liam Kerr, be followed by Monica Lennon.
Thank you, President Officer. My question is for the Cabinet Secretary for Justice. Many Scots will be wondering today to what extent the police will enforce this effective lockdown. So, keeping things to a very practical level and to emphasise the importance of compliance, is the Cabinet Secretary first of all able to help people understand what they might expect to be asked by the police if challenged? And can he outline what powers Police Scotland have already before the emergency legislation is passed to ensure these essential restrictions are obeyed?
Cabinet Secretary Hamza Youssef.
Can I thank Liam Kerr for the question? Can I just reiterate the approach as outlined by the Chief Constable over the last few days? And that's been first and foremost to thank the majority of the Scottish public who have complied with the guidance that has been forthcoming from both the UK and the Scottish Government. And of course the Chief Constable is at pains. I heard him this morning on the radio also to say that the vast majority of people are of course complying. But also the Chief Constable has made the point in his operational responsibility and independence and his responsibility that he has to keep the public safe. Then where he has enforcement powers, he will certainly use them. And we saw that when closure notices were forthcoming in relation to those premises, those pubs that did not comply with the order to close. In relation to existing powers, there are existing public health measures that apply in Scotland, which are similar across the UK. They already permit, for example, court orders to quarantine persons who are suffering from an infectious disease. However, of course, as the member will be aware, with the emergency legislation that is going through respective parliamentary processes, that will give more stringent powers, but also powers that can be used, frankly, on the spot, as opposed to necessarily having to go through court orders. But of course, we are appealing to people to heed the advice for themselves, for their safety, but also for the safety of the public at large. So the police will continue to take that approach with the public, but of course, where necessary, the Chief Constable has already demonstrated that where he has to use enforcement powers, he will do so.
Monica Lennon, to be followed by Joe McAlpine.
Thank you. A question for the Health Secretary and then a brief one for the Community Secretary. In relation to the letters going out to high-risk individuals, can the Health Secretary say when people can expect to get those letters? And, you know, we heard today that there's almost 600 confirmed cases in Scotland. What is the community surveillance telling us in terms of what the likely number of cases is likely to be? And this won't be a unique example, but last week the very welcome announcement with the Wellbeing Fund of the £50 million. Charities and others are waiting to hear when they can access that money. Bernardo Scotland have told me that they've identified just over 2,000 children who could be doing with that money right now. They can get that out to those families. Can we get an update on how quickly charities like Bernardo Scotland and others can get access to that critical fund?
Could I ask members just to restrict themselves to one question from now on? Jean Freeman.
Thank you. I'm grateful to Ms Lennon. On the two questions, in terms of the information, the direct information going out to that group of 200,000 patients at most at risk, that began today. It goes out by various different means. Some of the groups are much easier to contact directly. Through others, the contact is through their GP. I'm happy to write to Ms Lennon and just explain the detail of that, but we anticipate that all of that work will be completed within a week. So by all those routes, that's what we will do. In terms of community surveillance, it's too early at this point to be able to answer that question with any sense of definition or robustness. But again, as we get the additional information, as that surveillance data comes in, as the First Minister described, we will make sure that we keep Parliament up to date on what that is telling us.
And Aileen Campbell.
Thank you, and I'm aware of the situation that Bernardo's have described to Monica Lennon. They're using funds of their own to support those families that they've identified at immediate risk. We have their submission in place. There will continue to be discussion between my officials to kind of go through some of that, but we're wanting to work at pace to make sure that we can get the support out to the communities that we know require it, and the community groups that are also emerging to support their own communities and to support their own resilience. We're working with third sector local authority partners to ensure that we get the right balance and blend of ensuring that local level, very, very local support gets through, alongside the bigger, broader, more thematic work that some organisations like Bernardo's can provide. But we'd also make sure that if anyone's facing financial hardship, that they should make sure that they you look to the welfare system, that they have got the right support and they're getting the right entitlements from that, and make sure that they've got their claims in to ensure that they can overcome any financial challenges that they've been plunged into as a result of the pandemic. But certainly we're aware of Bernardo's ask, we're working on it, and that has been just in a case of, that's just been a space of a couple of days.
Joan McAlpine, to be followed by Miles Briggs.
Thank you. My question is for the First Minister. I've been contacted by a number of self-isolating elderly and vulnerable people who cannot get food delivered by the supermarkets, who are in many cases booked till mid-April, and these people feel that the hourly shopping hours set aside by the supermarkets isn't safe, although it's well-intentioned, but it contradicts the self-isolation advice. Is there any plan for the government to work with the supermarkets to perhaps prioritise deliveries to vulnerable people? And also, can I ask you to clarify that in off-grid areas, that suppliers of wood fuel and biomass are essential services that people can continue to use to heat their homes? Thank you.
First Minister.
Well, in terms of elderly people, I mean, obviously the advice we've given now is for everybody to stay at home, although they can go out for basic necessities, preferably no more than once a day, and that would be the case for an elderly person if they're able, unless of course they have symptoms or they're in one of the other groups that require more of an isolation approach. So I just want to make that point clearly. We have been in dialogue with the supermarkets. Fergus Ewing has had those conversations. I know the supermarkets are working hard in terms of trying to make sure they have supplies flowing, and also that those who have most priority get the earliest and most prioritised access to them, and they continue to work hard to make sure that that is the case. I would take the opportunity to give another general message to the public about not panic buying and stockpiling, because it is that is causing supply issues, not any underlying shortage. There is no shortage of food in the country. So if people act responsibly, buy responsibly, shop responsibly, then these issues should not arise. Obviously, our resilience partnerships are working locally, and part of the focus there with local authorities is to make sure we are doing everything we can to identify any particularly vulnerable people who are not able, through their own family networks or through their own ability to get the supplies they need, and that work is really important. On the biomass point, I'm happy to take that away and give an answer based on some proper advice. I would just repeat the general advice to businesses. We've given information on those who should definitely be closed, those that should definitely be open because of the essential nature of the work that they're doing, and some key checkpoints, if you like, for those in between about whether they can operate safely or not. There will always be a number of specific questions. I'm certainly getting lots of them today. We will not be able to answer every single question with specific bespoke advice, but we will do our best to give every company and every sector the detail that they need and the guidance that they need to make the right decisions.
Miles Briggs, to be followed by David Stewart.
Thank you, Presiding Officer. This is a question for the Health Secretary. For the 200,000 of our fellow Scots who will be receiving letters this week, it will be deeply concerning. But for those who are currently going through cancer treatment or about to commence their cancer treatment, it's terrifying. It's a terrifying time for them. I know from the emails I've already received. So can I ask the Cabinet Secretary, when will the Government update Parliament with regards to the Cancer Action Plan she announced last week, so we can make sure we continue to deliver cancer treatments through this public health emergency?
Jean Freeman.
So I'm happy to make every effort to update Parliament next week on the Cancer Action Plan. I think what is really important is that we recognise that our National Health Service is not only stepping up to address a particular challenge of this virus, but is also continuing to treat patients in terms of emergency urgent care, and that includes cancer and maternity care. So, and I also appreciate that this is a worrying time for everyone, but particularly for that group of people who we are strongly urging that they isolate in their own homes for 3 months. That's really very stringent, and that is because they are most at risk of becoming very seriously ill indeed if they contract that virus. So there is much for them to worry about, but many of them already know all the steps that they need to take in normal course to protect themselves because of the condition that they suffer from. What we need to make sure of, and what I tried to outline, and again, very happy in the coming days to set out more detail for members through a letter or whatever means we might find, what they really need is to know that the additional support that they need, where that cannot be provided by family or friends, and again that needs to be very carefully done about how that contact is made. That additional support is support that with our local authorities, through the resilience partnerships and with an army of volunteers, in fairness, we will make sure is provided as much as we possibly can.
David Stewart to be followed by Sandra White.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Health. In previous statements, the First Minister rightly referred to the crucial role of ventilators in ICUs and their critical shortage worldwide. Does the Cabinet Secretary welcome the breaking news of the development of rapidly manufactured ventilation systems, which are lightweight, robust, and require no more than 30 minutes training for a hard-working medical staff to use?
First Minister.
So Mr Stewart is absolutely right, and he and I have talked more than once about the situation in ventilators, indeed only this morning at committee. So any innovation that comes forward that is robust, that we know is evidenced and exists, is something to be welcomed. And that indeed is why my colleague Mr McKee has his very focused group looking at the whole manufacturing those innovations, testing that out with a degree of expertise and skill in order to advise me as the Health Secretary whether this is a genuine opportunity for us to very actively pursue. So that cross-government look at how we acquire the equipment that we need to address this particular challenge is a really important one, and one that I very much welcome.
Sandra White to be followed by Jamie Green.
Thank you very much, Presiding Officer. And I thank the First Minister for her statement. This question is for the Education Cabinet Secretary. Cabinet Secretary, I've received numerous correspondence from students who have been told, foreign students who have been told they have to go home and they're having to pay their rent up until August. I also have other students who are were working and are not working now and can't afford to pay their rent and being told they have to pay for their student accommodation. Can the Cabinet Secretary tell me perhaps SAS or someone else can give them some form of financial help in this particular situation?
John Swinney.
Presiding Officer, these issues are under very active discussion between the Higher Education and Further Education Minister Richard Lockhead and a number of providers. A lot of the accommodation to which Sandra White refers is in the private sector, and obviously we are trying to work to protect the interests of students who are facing increased costs as a consequence of the situation that they face. So the furthest I can go today is to say that we are actively pursuing the issue. We recognise the seriousness of it as it affects individual students, and we will of course update members, and particularly Sandra White, on the progress that's made in those discussions.
Thank you. Jamie Green to be followed by Neil Findlay.
Thank you. Many parents are very grateful of the work of local authorities who in just a few short days set up provisions for schooling and childcare to those who need it most. But many others are doing their best to teach and care at home in very difficult circumstances. So may I ask the Cabinet Secretary for Education what role Education Scotland is playing to assist COSLA and local authorities support and equip parents with the resources they might need to best teach at home, but more importantly, when will the SQA be forthcoming with detailed advice around the completion and submission of coursework and the new process for awarding qualifications?
John Swinney.
On the second point that Mr Green raises about the SQA, I would ask members to be patient and to understand that we are having to move significantly in a very short space in time to a new way of working. I expect the SQA to make a statement this afternoon in relation to coursework, which I hope will clarify the position, and obviously the material that I set out to Parliament last week in relation to the certification approach is being actively developed and is I appreciate the anxiety and the nervousness, but we have to take time to get that correct because young people's qualifications will rest upon it. In relation to the first point on the availability of online learning, there is a huge amount of really outstanding work being done by teachers around the country. I know that the Swinney household yesterday morning was involved in an online PE lesson in which all members of the household took part, except the oldest member of the household. And there's a lot of really good work that's been undertaken. Education Scotland are actively working with individual local authorities and schools to support that work. Essentially, schools have done a really good job in trying to make sure they've got digital connectivity with young people and students, and Education Scotland are supporting the development of any appropriate resources that are required as part of that process.
Neil Findlay to be followed by Emma Harper.
I don't envy the government's position, and I accept the First Minister said the government will make mistakes, and we all accept that. But does she recognise that some Scottish professors of global health are saying we're making a mistake just now by not following the WHO advice to trace every case, to test every case, and to isolate every case?
First Minister.
So can I try and address this point again in detail, because this is a point that I have asked a lot of questions of my advisors of. The WHO advice, and I certainly am not qualified to second guess it, but it is very much for, as I understand it, a contained phase of an infection outbreak. We are in the delay phase. Now, I want to be absolutely blunt about this, and the UK, Scotland within that, probably has, certainly based on what I have been told, per head of population proportionately, the greatest testing capacity of perhaps any country in the world. We could not test every single person with symptoms right now. It would overwhelm not just our testing capacity, but the resources of our NHS overall. We are ramping up testing capacity significantly within our own labs. That's the Health Secretary and I have already alluded to today. There'll be another significant announcement UK-wide to add capacity substantially to that. But we will still have to prioritise where that testing capacity has greatest effect. And that's the three areas that I have already set out. Now, in terms of Neil Findlay's question, which I understand about testing, tracing and isolating. Of course, I've set out the position on testing, but we are asking anybody with symptoms to isolate. That is the whole point of the advice that is being given. If you have any symptoms indicative of coronavirus, and for the avoidance of doubt, that is a new persistent cough or a fever, you should be staying at home. You should be staying at home for 7 days. If you're in the household of somebody with those symptoms, you should all be staying at home for 14 days. So, you know, if we had the capacity to test everybody with symptoms right now and we got positive cases, the advice we'd be given to those positive cases is exactly the same as the advice that we are given to those with symptoms. So we are in the delay phase of this, and that's why the approach to testing and all of the advice that we are giving is, in the opinion of the experts that advise me and the Health Secretary and the Government, the appropriate action to be taking. And I repeat again, that is testing for those most seriously ill, testing for key workers, and testing to allow us to monitor the spread of the infection and how it's behaving in certain other ways, which is similar, but it will be on a bigger scale to what we do every year with flu.
Emma Harper to be followed by Maurice Golden.
The First Minister has already described that she is all too aware of the incredible work being carried out across our health service during what is a difficult time for our NHS staff, many of whom are my former colleagues. Can she provide, or the Health Secretary provide, assurances that mental health support will be available to NHS staff should they need that support?
Jean Freeman.
Thank you. I'm grateful to Ms Harper for that. It is very important, and the point I want to make about that is that what as the First Minister and I have said, and the Chief Medical Officer has said, what we are attempting to do with all of the measures now in place is reduce the peak level of cases so that our health service can cope, and so we reduce the number of avoidable deaths. What that does mean, though, is that our health service will be working under significant pressure for longer. And so the health and well-being of our NHS and social care staff is really important. And that is why Ms Hockey, as the Minister for Mental Health, is leading a piece of national work with individual boards and extending through to local authorities and social care providers to look at what more, in addition to what they are doing, what more we can do to assist them to ensure that support is available to staff in situations of high stress and anxiety. Practical support is available to them in terms of rest areas and just the ability to make a cup of tea and take 5 minutes or 10 minutes out. And the other support is available to them online or directly, depending on what makes most sense and is most use to them. And as that work solidifies or consolidates across the country, then again we will be very happy to make sure members understand what it is we're doing and hear from them if they think there is more that we can do. But please be assured, we take that very, very seriously indeed.
Maurice Golden, to be followed by Polly McNeill.
Thank you, Presiding Officer. My question's on roadside recovery, and happy for the most relevant Cabinet Secretary to respond. Will further guidance and support be issued for the roadside recovery industry to allow them to continue essential emergency response during this period?
Cabinet Secretary Michael Matheson.
Presiding Officer, I'm aware that the sector have raised a number of concerns going forward that may create some challenges for the industry in being able to provide the level of resilience that's necessary in roadside recovery, particularly in helping to support our logistics and haulage industry, where they play a critical role in helping to maintain essential links. We're in discussions with the Department for Transport within the UK Government to look at what further measures could be put in place to help to support the industry during what is a challenging time. Of course, it is absolutely essential that we maintain our transport and logistics network at this crucial time, and the essential work that the recovery services play within that is fully recognised by the Scottish Government, and also from a discussion we've had with the UK Government by the UK Government. But I can assure the member that it's an issue which we are very much aware of and will continue to work with the UK Government on in seeking to try and resolve some of the concerns which the sector have.
Polly McNeill, to be followed by Bob Doris.
My question is to the Cabinet Secretary responsible for housing. Thanks to the First Minister for her statement that there should be no evictions in answer to Patrick Harvey. Well, will the Government actually legislate for no evictions? Because the one they previously announced was extremely narrow. There are 17 grounds for eviction. We need to remove them all. So will they legislate as soon as possible for that? Rough sleepers are amongst the most vulnerable people and unable to self-isolate. Can the Government ensure that they are not criminalised in any way? And can she give any details of any package that they are intending to announce to help rough sleeping?
Aileen Campbell.
And again, we've been very clear that nobody, as a result of the ability to cope with this pandemic, should lose their houses. There should be no eviction as a result of COVID. And our emergency legislation will have provision to ensure there can be no evictions from the private rented sector or the social rented sector for 6 months. And aside from the legislation, I have also had assurances from the SFHA that they will not, and their members will not evict anyone at all during this time. But of course, we're going to take forward the legislative packages. Now, there's old version. Tennessee, the assured and short assured, has 17 clauses. The new one has 18. We're looking to use and extend notice for the majority of those grounds. And of course, we'll continue to explore with you any issues you want to raise with that. But I hope that gives you some certainty that it's not just on the arrears, but it's looking at the number of clauses for notice of eviction, and to extend the majority of them for the 6 months to essentially give effect to the fact that we do not want to see anyone lose their house over the head of this pandemic that we're trying to cope with.
Bob Doris, to be followed by Murdo Fraser.
Thank you, Presiding Officer. It's for the Cabinet Secretary for Communities. I welcome the announcement about the potential grocery contract to get food to the most vulnerable 200,000 that the First Minister referred to. But can I ask what clear and practical advice for those who are addressing food need in our communities now or imminently will be in relation to those who are attending food banks or food hubs to make a donation, because there are safety issues potentially there as well, or to receive support, for volunteers heading to food hubs to prepare and supply that food, including sometimes coordinating home delivery. It's important that this can function, but people are as safe as possible, exercise sensible social distancing, and we're not inadvertently spreading the coronavirus as a result of that on-the-ground strategy, which is absolutely vital.
Aileen Campbell.
Yeah, thank you. And there's a range of good points that Bob Doris makes. I think, again, the First Minister made mention of the ReadyScotland.org website. I would certainly ensure that Bob Doris is directing any queries to that website. That will give good guidance about how to keep yourself safe and to keep everyone who wants to volunteer and play their part safe as well. We are looking to and have worked with and are continuing to work with Fair Share Scotland to ensure that that is one way to distribute food and support to food banks, but we also know that there are food banks that are facing particular pressure. So again, with the £70 million that we announced last week, we want to ensure that there can continue to be an adequate food supply for people who are requiring it or facing that financial hardship. And again, we are working with Social Bite as well for those that are homeless, and they're actively at this point in time distributing food out to those that are particularly vulnerable as well. So in amongst all that, there is also scope for any local initiatives to come forward, ask for support if they require it, so they can help with the resilience of their own community. But I think the point is well made that we need to make sure that the balance is there between people staying at home alongside the advice and support that they require to ensure that that volunteering effort can continue.
Roger Fraser to be followed by Jackie Bailey.
Thank you, Presiding Officer. I have another issue around food supply and food security, which I think should go to the Cabinet Secretary for the Rural Economy, but I don't think he's here, so I'll let the First Minister decide who's going to answer it. There are soft fruit growers in my region in Perthshire and Fife who at the moment are very concerned about the availability of labour to harvest crops in the summer season due to the fact that the normal migrant workers they depend upon may not be able to travel to the United Kingdom. What advice would the First Minister give to those looking to plant crops at the present time, and what assistance can the Scottish Government give to this sector about accessing the labour that they need?
Minister.
Rather than give advice right now that may not be the right or the best advice, can I undertake to take that away and come back to Murdo Fraser very quickly with some advice, and we will then disseminate that to the wider sector, because it is an important point that we want people to be doing the right things now in order that they are not compounding issues for themselves in the future.
Thank you. Jackie Bailey to be followed by Kenneth Gibson.
Could I ask the Deputy First Minister about the designation of key workers? There are police officers who are considered to be Category 2 workers, being denied childcare, severely compromising their ability to do their job. Pharmacy and food retail workers who've been working really hard are defined by the Scottish Government as being part of the critical national infrastructure. Can he confirm that they too are in Category 2 of the key worker definition, because in some areas they're being denied support? So will he therefore ensure that the guidance to local authorities is clarified to avoid a myriad of different approaches being taken, so that our Category 2 key workers receive the childcare support they need?
John Swinney.
Well, there are a few, I understand the seriousness of the issues that Jackie Bailey raises, but there is also an important point that has to be borne in mind, and that is that we have to minimise the number of children that are brought into learning and childcare settings, because if we don't, we will defeat the public health advice that is driving this exercise. So I'm sorry if that sounds hard, but we have to be conscious of the need to limit the number of children coming into settings, which is why I appeal to employers and to families to follow the tiered guidance that we've put in place, which is about trying to find alternative solutions for childcare before trying to secure childcare settings through local authority provision. Now, we have deliberately left flexibility in the hands of our local authorities. Whilst giving the clarity which Jackie Bailey sets out in the guidance, I confirm the points she makes about the composition of Category 2. We have deliberately left flexibility with local authorities to take into account the circumstances that are presented to them because in some parts of the country there will be some sectors that are more prevalent than in other parts of the country. If we specify a uniform national approach, then we will create just a different set of anomalies to the ones that Jackie Bailey has raised with me today. And as a consequence, we will not enable the key workers that we need to be able to contribute to the national effort and who need childcare support to be able to get that. And that's the objective that we jointly share with our local authority partners.
Kenneth Gibson, to be followed by Alison Johnson.
Thank you, Presiding Officer. My question is for the Finance Secretary. Last week, the Bank of England cut base rates to a record low of 0.1%, but few banks have passed this on to borrowers, and many have actually increased loan and overdraft charges. For example, HSBC has increased overdraft charges on unauthorised overdrafts from 9.9% to 39.9%. Does the Scottish Government agree with former Pensions Minister Barness Altman that credit card charges should be cut to 0.5% for the next 12 months? And will the Cabinet Secretary raise the issue of loans, overdrafts and credit cards with the Financial Conduct Authority?
Kate Forbes.
Well, I am in regular, as is Fiona Hislop, contact with the banks and the wider financial industry. And if there are particular areas of concern, then I'd be more than delighted to raise that directly with the banking industry. In terms of the support that's available, whether it's banking support or government support or the welfare system, all of this is designed to allow people to continue to pay bills, to feed themselves, and to go about their daily business. And any form of government support is designed to be supportive to people's cash flow issues right now in light of redundancies and other things. So the expectation on banks is to look favourably at any requests whatsoever from individuals about payment deferrals and about reducing their costs, not increasing them. So where there are specific issues, please raise them with us. These should also be passed on so that we can raise them with the banks directly.
Thank you. Alison Johnson, to be followed by Bruce Crawford.
Thank you. I welcome the Health Secretary's pledge to expand testing for NHS staff, but current guidance tells NHS staff with symptoms you will not be tested. Will this message, which has been sent out on a daily basis and again this afternoon, be updated to ensure that the concerns of frontline NHS staff and indeed the sustainability, to ensure that that is addressed as a matter of urgency?
Jean Freeman.
Yes, it will. I mean, there was no point in telling people they would be tested until we had the processes and the systems in place to do that. Now that we have, to begin that work in the way that I described, then we will update that guidance, but it needs to be very clear about how we are testing to the capacity. As the capacity increases, we will be able to increase that.
Bruce Crawford, to be followed by Alex Cole-Hamilton.
Thank you, President Officer. I think this question is for the Cabinet Secretary for Transport. I wonder if he can help give advice to a frontline ambulance driver. His car's MOTs runs out at the end of the month. His garage is now closed. He cannot find another MOT appointment. He lives 30 miles away from his hospital where he starts off his work from. I'm not expecting necessarily an answer today, Cabinet Secretary, but he'll not be the only emergency worker in such circumstances. Is there a case for the DVLA waiving MOTs in these circumstances, or is there another way forward for such important workers?
Michael Matheson.
Presiding Officer, Bruce Crawford's raised a very important issue, and that is the growing challenge we have around individual car owners being able to get access to an MOT check being carried out on their vehicle, which naturally can have an impact on them being able to tax their vehicle and also invalidate their insurance if they no longer have a valid MOT. The member may be aware that in Northern Ireland, where they have powers around this, that the Northern Irish Assembly have given an exemption certificate for some 3 months for heavy goods vehicles, for buses and also for trailers, but not for cars as yet. And the reason for that is because we're in discussions with the Department of Transport to see if there's a means by which we can actually provide a UK-wide exemption for a limited period of time for those who may own a car of 4 years or more. I recognise a very specific challenge that this is creating. We've raised the matter with the Department of Transport, and the obvious solution would be to give people an exemption certificate for some 3 months, which would allow their insurance to be renewed if necessary, or to remain valid, and also to to renew their tax disc if necessary also. But I do recognise a specific issue and will continue to press the Department of Transport on the matter to get a resolution to it quickly.
Thank you. Alex Cole-Hamilton, to be followed by Willie Coffey.
Thank you very much, Presiding Officer. The First Minister will recognise the tremendous upsurge in community spirit growing in our communities, in the mutual aid groups and neighbours doing favours for neighbours, in 1,000 seemingly tiny acts of community service. An example of this goodwill can be seen in the hot meals being safely prepared right now and delivered free of charge to vulnerable people in self-isolation. Two organisations operating in my constituency, the Scran Academy and the Torfin Pub, will deliver over 1,000 such meals this week alone. They are concerned that when the police begin to enforce lockdown, their drivers and their cooks may be prevented from delivering this vital work. Can she reassure them that this work will be allowed to continue during lockdown? And can she explain to the Chamber the system that will operate to allow key workers to move freely during that lockdown period?
First Minister.
Oh, can I firstly take the opportunity to thank the countless numbers of people across the country who are stepping up to volunteer and make a contribution. I know I've seen lots of examples of that. I've had many emails from people offering their help, and I think I'm not at the stage really where it's possible to put a silver lining on this horrible cloud, but I do think there are elements of in which we are seeing the best of people and the best of communities, and that is certainly something to hold on to and be inspired by. In terms of the specific point, we're very clear we want that voluntary effort to continue. We want people who are caring for others to be able to continue. I have confidence that the police will well, firstly, we'll not have to do enforcement because the vast majority of people will comply with the rules that we are asking them to comply with. But we have good community-based policing by consent in this country anyway. I spoke to the Chief Constable last night after Cobra took these decisions, and he is confident that he will be able, and his officers will be able to police this in an appropriate way. And any enforcement will be for the minority of cases, and I expect it to be a tiny minority of cases that are flagrantly breaching the rules with no consideration for others. And I know the Chief Constable and the police are very mindful of the need to allow that voluntary caring effort to continue because we all need it to.
Willie Coffey, to be followed by Mark MacDonald.
Thank you. First Minister, I'm still getting messages right now from worried constituents who are being dragged into work by their employers, who are not in the key categories that you mentioned earlier. What enforcement powers will we use to force these employers to close, to protect their staff and to protect the wider public?
First Minister.
I want all employers to behave responsibly, and I think the vast majority of employers are behaving responsibly. If somebody is running a business of the type that has already been told to close, so pubs, restaurants, now non-essential retail, then just as the police did with closure notices over the weekend, and when the new emergency powers come into force, that will be enforced if necessary. I fervently hope it will not be necessary. There's, at the other end of the spectrum, categories of business that we know have to continue because they're vital to the effort to fight coronavirus, and they are vital to keep the country, the well-being of the country going. So food supplies, energy to keep the lights on. There is a difficult group of businesses in between where we cannot give a categoric answer for every single one on a bespoke basis. That's why I am trying very hard, and will continue to do so, to set out clear guiding principles. And the first principle is employers should take responsible decisions based on a precautionary principle. If you're in any doubt that what you're doing is in any way putting the health of your workforce at risk, you should not do it, and you should not be open. And I think that is the first principle. Secondly, you should be allowing your staff to work at home whenever possible. Now, there are some businesses, the nature of which that is not possible. So then the questions that must be asked for people, if they consider themselves to be doing essential work, is, are you able to have safe social distancing and obviously comply with all the normal health and safety requirements? Now, for a business, if the answer to any of these questions is no, then you shouldn't be continuing as normal, and you shouldn't be continuing to expect your workers to come to work. So we will do our best, in addition to that guidance, to try to offer specific guidance to sectors or companies as these issues arise. But the overall thing, just as we are saying to the public, do the right thing for the right reasons, I have to say to businesses, please do the right things for the right reasons. This is a horrendously difficult situation for everybody. Nobody doubts that. And I don't doubt for a minute the really difficult decisions businesses are having to take. But these measures are in place. And I come back to this central point. These measures are in place to save lives. And I would ask everybody, whenever we're feeling frustrated about all of the inconveniences and disruption to our daily lives just now, individual and business lives, just remember that. What we do right now will ultimately determine how many people die from this virus. And the more of us, businesses and individuals who do the right thing, the fewer people will die. And I think that should be the motivation for each and every one of us.
I'm conscious we're not going to be able to get through every member. However, I'm going to extend the session till 10 past, so another 7 minutes, with members' understanding. Mark MacDonald to be followed by Fulton McGregor. Mark MacDonald.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Health. There are individuals with addiction issues who, up until this moment, have been receiving treatment through the NHS. There are individuals with addiction issues who have been receiving support from groups such as Narcotics Anonymous, Alcoholics Anonymous and Gamblers Anonymous. And there are individuals with addiction issues who may not yet have sought treatment but face the possibility of 3 weeks of inability to feed those addictions, while at the same time being in the household with family members who may not be aware that they are living with an addict. These are 3 very different categories who require 3 very different pieces of advice, support and assurance. Can the Cabinet Secretary advise if this is under active consideration and what steps the Scottish Government will take to support both those individuals and also family members who either are supporting them through their addiction or may not yet be aware that they have an addict in their household?
Jean Freeman.
I'm grateful to Mr MacDonald. This is a very important issue and Mr Fitzpatrick and I have been in discussions about that. It is under active consideration what we might do. Some of the organisations that you've mentioned, by their very nature and by the ethos by which they work, will want to be very self-contained in how they continue their work whilst maintaining social distancing and so on, and I know are actively looking at means by which they do that. We will make sure that they have our offer of support if they wish it and if they want to take it. On the last group, if you like, that you mentioned, that is a particularly hard area to work through how we might offer that support. Not about the individual who has that addiction and those difficulties, isolating or staying at home, but where their family does not know about that and what support we might then offer. So we are giving that active consideration. I'd welcome any specific propositions that members have that we should, they think we should be considering in that particular area, and I'm very happy as we make progress on this to make sure that members are updated on the work.
Fulton McGregor to be followed by Brian Whittle.
Thank you, Presiding Officer. My question is also for the Cabinet Secretary for Health. I'm wondering, it's on tests, and I wonder if there's an update on the antibody tests that were previously talked about, when they may be available. And does she feel that this could be a crucial test in identifying who has had the virus, and particularly important for those in the front line?
Jean Freeman.
So, Mr McGregor raises a very important question, and this is and will be, when it is available, a very important test for us. Our current understanding is that we are hopeful it will be available in the near future, and I recognise that is completely without any specificity, but as the First Minister said, better to give members accurate answers that we can be confident of. So at this point, all I can say is we are hopeful it will be available in the near future.
Brian Whittle to be followed by Anas Sarwar.
Thank you, Presiding Officer. A question for the Cabinet Secretary for Communities. She is aware, of course, that the third sector are under a lot of pressure just now and are working with some of the most vulnerable in society. People like with poor mental health or addiction or homelessness or even Alzheimer's disease, where isolation has traditionally been the enemy, and of course now the advice is completely opposite to that. So can I ask her, can I ask the Cabinet Secretary what support and advice she can give to the third sector who are trying to work through this difficult time?
Aileen Campbell.
The third sector, who are absolutely fundamental and crucial to the response the country has for the pandemic, and My officials are actively working with some of the organisations that cover the issues that Brian Whittle raises about the funding that we announced last week around the third sector resilience, so that more general resilience fund that they will require to help them continue to function, alongside the support that they will be able to do to help the communities and to prioritise some of their existing work to cope with the demand that will be placed upon them. So officials are actively working with a number of different organisations, SCVO, the Corra Foundation, Hunter Foundation, a number of organisations like that, to ensure that we get the resources in the right places as quickly as we can to support the need that Brian Whittle rightly recognises.
And ask Sandra.
Presiding Officer, can I thank the First Minister, all Ministers and officials for their positive engagement. Yesterday I heard the Cabinet Secretary say that the minor ailment service will be expanded. That will obviously put more pressure on pharmacies, so I wonder what acts have been taken to make sure there's positive equipment being supplied to pharmacies. There's also a number of opticians, dentists, dental nurses who have skills that can be used in the National Health Service. What has been done to draft them in to support existing NHS staff? And finally, a sensitive issue, a number of doctors, for a variety of reasons, have opted out of the Scottish Public Pensions Agency scheme, meaning that if they were sadly to contract the virus and to die of it, they currently, as it stands, would not get, or their families would not get, the death in service payment. What immediate actions have been taken to reassure those individuals that their families would receive such a payment? After all, they are the heroes at the front line in this crisis.
Jean Freeman.
Thank you very much. Grateful to Mr Sauer. Can I start with your last question? That is actively being looked at the moment to see what we can do in those particular circumstances, fully taking on board the points that you make, and in discussions partly with the UK Government and also partly with our Scottish Public Pensions Authority in that regard. We have, as you say, we have 1,257 community pharmacies, 2,500 community pharmacists across Scotland, a huge resource and one that is very keen indeed to be actively involved in the extension of the minor ailment service. Their access to the emergency care record came as a direct result of meeting them last week, and I'm very pleased and grateful to our Chief Pharmaceutical Officer for ensuring that happened in the space of days. That is a huge resource to healthcare in the community. And we have also had discussions with them about the particular PPE requirements they have and the additional other requirements that they have too. And I'm very confident that that will make a significant difference. In terms of the other professionals that you described, you're absolutely right. Dentists in particular, but also those others, all have really significant skills. I'm really pleased to say that many of them have been in touch to say, how can we help? We are undertaking emergency treatment only at this point, and as a result of guidance from the Chief Dental Officer, what more can we do? And the Chief Dental Officer is actively looking at how we can harness that particular workforce. And in terms of optometry, then of course they will be able to provide significant support on emergency eye treatment. We have reached an agreement with them in terms of the sustainability of their funding in a situation where they won't be undertaking some of the work that they normally would do and are paid for. So we have reached an agreement with them to ensure that their businesses are sustainable through this period, and they will continue to undertake that emergency eye treatment. All of that is then fed in to those to NHS 24 and others, so that they can point people in the right direction for the care they need.
Thank you very much. I'm very conscious that a number of members have sat patiently through the session waiting to ask questions, and I'm afraid I can't take any more. We've got two substantial statements coming up from the Lord Advocate, the Cabinet Secretary for Justice, as well as emergency legislation and a local government finance orders. So we have to move on to the next item of business. Thank you to members and ministers for your understanding.